Mamunyina Kwaba, Essign so Edamosema
on Asempa FM.
Aba. Bidid your sabon, so make us say Dr. Edward or Maneboama Atnase. Ewo studio hayene no eba ababedi enkomo in seminal edoso but what him say enche na what we mo Monday ya na party odom the largest opposition party in our country launch one manifesto. Before the manifesto launch no they are part national communications officer the statement by now or they various spokespersons din ebetuja for various sectors of the economy. So our list anymore Dr. Edward Maneboa Manani Dinwo and health or more Kasama party, you know, as far as their manifesto is concerned, and health. And wow on Saka NDC manifesto libino health for all. Oshe pages 62, 63, 64 65, 66, and 67. And pages way and a casa efa health. Yebeshedi home come to interrogate some of the policy proposals, promises a war document ye emu. Yebedis uncommon in 90. Oma categorizing your health policies, your health infrastructure, capacity building for health financing, a program of action for COVID-19, supporting frontline workers, increasing national supplies of PPEs, and international actions. Ninyana ehon sem ewa ha yebehwe na yetumi edi ehon comment monsha nenso emayen. Doc, akwaba na apom te sen.
Minya me da wase. We de mam che nso.
Me ametimi ho. Facha yen.
Nse yeah, for time in the agro.
Yeah.
But
I can see that.
Na a year some. I made them say, Massa Ababe P. Hasi.
Yeah, that's it.
I didn't check a sense what here for your loyal listeners.
Also.
And I Ghana Funina Umuti or Yamamuha. And now I'm an onenso. My Ghana Nkoso and Unina Yepe.
Yeah.
Kwanya yebetumi afaso ama yaman no akoso ene se kabmamen ka bia mamudi wo kire wadwen na obi nso akire na dwen na omanfo no the sovereign people of Ghana ebeteki the ultimate decision say we no adwen no ekọ enimu yie
ekosi say on Asempa FM
say you launch your manifesto fi Monday ebesi sabri a month for energy I manifesto no homes. I mean make sure the number of calls, not just from media houses across the country, but individuals at Abisa now we say Yanso Yadi watch we are Mukaye send a child say the interest no I generate the desired interest. Now Asemba Kopena a bit to me explaining and he said the people's manifesto. He said largely no, the ideas no, if he Ghana for in chain ankasa and not a buy, and that is the approach. The etros I manifesto with. You know, I'm very very happy. Say, if Yenuanoma Omo MPP will also concentrate, unfortunately, and I'm sure you agree with me, Omo I manifesto no. And gaining the kind of traction manifesto no again, you know. Because of that, you know, they have to find innovative ways to put out their messages so that Ghanaians can contrast the policy I propose. But I never you say health for all. There see any so say yeba ababe. Health for all no. Over the years, at least from Osasco Takwame and Nkrumah time or President Ghana for Benya health care no money at their day, all the way somewhere around 1978 or another world who say still yentumi achieve sa adia say ubia yare a Benya health care no money way. So World Health Organization is a meeting kase and Omoka say I was here primary health care.
Yes.
Beyond that, there were several attempts. Still not encourage universal health coverage and so ABBA still Millennium Development Goals also ebaye. Unfortunately, the structure of the Millennium Development Goals, now a too vertical. Say, almost HIV/AIDS interventions, maternal and mortality interventions, infant. Until sir, vertical programming this you suffer what I will call unintended consequences. Because whilst I focusing on reducing HIV/AIDS, maternal mortality, maybe other things also suffer.
Yes.
So the SDG 3 share health for all, so that you develop a system-based approach to it instead of just looking at specific eye conditions and dealing with them. Adia bakwa ema health system also a trigger in contemporary times. Ebola. In health eye policy I discuss now. Almost everybody was talking about what Ebola had done between 2015, 2016, and the need for strengthening of your health systems. Sometimes in my conceptualization of the health of the world, I say, was Ebola like a trigger, the John the Baptist, the forerunner to COVID, say, Oba ababe bomukoko say, man strengthen health systems are Bibiba. You understand? Just imagine for one moment if NDC are led by President Mahama at the time, near University of Ghana a medical center to the level
you could see saying on Asempa FM.
And a center meye the primus inter pares has say in terms of the management of COVID cases. No money are there. I COVID by. But because he focused also on infrastructural development to strengthen our health system, it's not just about developing infrastructure. And when COVID we were able to say, okay, these hospitals are the main areas. Just imagine if all these COVID cases in Kolebu Teaching Hospital, because take away the Rich Hospital expansion, take away the University of Ghana Medical Center. Kolebu is your premier hospital, your hospital, and no say or the Magajia, the prima idona. Say a honor ode COVID cases in it means anka ventilators are a Kolebu. A babe now will shortfall. You will not have ventilators for major cases. Anesthetists
on Asempa FM.
I was said would deploy towards taking care of in critical conditions. Hospital beds, pneumonia there. And basically, anka your health system was going to run ground. We need to do more to build on your health system. No, President Mahama, Oye in the health sector, Oye bipa, and to say if say all promises say, we need to take the goal of health for all notches higher through specific policies. Senya o keka it be a capacity building, it be a financing, it be a infrastructure, and I come in Nankasa. This is Bibia Ghana for AGDA. One of the major promises are Yama.
And the health for all.
Yes, and the health for all. Free primary.
Provide free primary health care.
Yes, free primary health care. Yama say, Nyankopon, dum, you did this Nyankopon so ebeto, nin soup, papa, egu. The manifesto is sending Ghana for Adiatum. I'm a yet me provide free primary health care. Mitremwa anything. In simple terms, Nyaye can say, so we are Ghana ni, Oyare, Oko District Hospital, Oko Polyclinic, Oko Health Center, Oko Chips Compound.
Asempa FM.
Eko sa uhuyaria. Untieska.
Yarabia.
Free.
Yarabia.
Uya Ghana ni. Oko district hospital. Oko polyclinic. Oko health center. Ana oko chips compound. Eko sa uhon yarea. Untieska. For Yarabiara odebeko. Osha primary health care na the key pillars na ijuna preventive bako. Curative in bako to cure minor common diseases and minor injuries no more. Promotive health and so to promote healthcare and so another one. So from the American UTN is going more towards the curative.
You could see saying on Asempa FM.
Somebody may raise a technical argument, say, oh, but there are some district hospitals that are running some conditions, treaty conditions, and falling under primary health care.
Primary health care.
That is a good and interesting argument to raise. But say, who raises this answer? I was say, implementation of policy, ease of implementation. Okay, I say, okay, my chips compound, any free, health center, any free, polyclinic, any free. Name who could do district hospital, any dia. So the yare ABC, eba, any free, DE there, any free. One person may come with the first group, any free, no. Another with the second group now, and also any free, no. You create unnecessary administrative problems for both the doctors and the nurses taking care. Any the finance teams within the various hospitals, no, billing and all those things will become a problem. So we are very much aware, say, there are some of the conditions are, strictly speaking, they will not fall within a primary health care, but of course, our district hospital. After all, it is healthcare. Ideally, it's a minor. All the resources at this stage. Why not? You could have decided, say, let it even be free all across. But at this stage, we know, say, there are difficulties with the economy and everything. So it's better you absorb the part which is within the district hospitals anyway. So this is a clear policy. I'm very interested in letting Ghanaians know, Ghana Frontiers here, what is in it for you. That is district hospital care free, polyclinic care free, health center care free, chips compound care and also free.
But how is it different from the ACCC? And I remember Dr. Mustafa Hamid that and he makes the point say health for all free primary health care just semantics because and with the current National Health Insurance Scheme, say, under 18 years, kosa when you are free because one unya card maybe elderly free, the vulnerable free. Yeah, you won't fin the tier premium kakra if you want to be on the system. We tier premium no in your card. Also the question when you are and really there is nothing new from the more promising.
You could see saying on Asempa FM.
I won't blame Dr. Mustafa too much. Health or health policy and strength. Otherwise, he knows, and he's committing a certain error. He or share Ghana healthcare through the lens of National Health Insurance Company. Oh yes, sir, Adena, why a fundamental mistake? The way healthcare at Minia, look, I am in full support of the National Health Insurance Scheme. And that is why your manifesto you the National Health Insurance Scheme no enya ahoden agina ebi ene se ye ka se sika e was a scheme ni
finance no ye be health finance
you make sure say e be come on regular basis no money ade but we are running National Health Insurance Scheme over a period. ABC ne minia unim the percentage of active members are a National Health Insurance Scheme.
You could see saying on
the population of Ghana.
You understand?
Yes.
In half of the population. Say, Ofra Ghana 30 million, ebia sabri, your cost rate to be 31 million. No money are there. Half of the population are not the enye omwa actively use national health insurance.
But do we know why? They are the entire.
Fantastic. There are so many reasons.
Yes.
Ebi and say ebesi sabri, and these are all evidence based. Ebesi sabri, out of pocket payments for overall healthcare, 40% out of pocket payments.
Or more, or person no alcohol hospital, no tree or no any sick.
No, ebi oho krampon so a ohwe we studies ni bi oho a obi oho a our card no nso obekọ because of rigidities in the implementation of the scheme no na we say otua sika even the bottom no if we share free primary health care from the lens of MPP you make a mistake. No, can say you should rather see free primary health care as a complement other forms of health financing. For instance, so unim say your private health insurance and so but still ebesi sabri yentimi achieve universal health coverage, yentimi achieve health for all. Actually, I was saying a dream outside the box. We have to think outside the box. Now you share, then na you bet me aye there systems na ewo ho ne ho. Send e be ya e be pushy. And no na ya share and ya say we need to strengthen the existing systems. But then biom na ubetimi nso e de aba. And no at the primary level, that is district hospitals all the way down. Look, let's cover everybody. Government, fund that from direct sources, a government. Not health insurance, that is, okay, health insurance is both national health insurance, private health insurance. And then there are other forms of NIPA, the financing health care. Ebi, medical savings account. Ebi crampo etimi obi oho etimi iska kakra to ho every month. Send a bear sebius will be area.
On Asempa FM.
All those forms of finances will be my abwa. So that together at the level of the primary, a free mobile, the health insurance, whether national or private or your medical savings account can be reserved for when ABA you refer from the primary level. Say be a secondary. Say be a wako mamu bi a polyclinic. Ni a refer say be a correct. Oko mamu bi a polyclinic no. How dey a free. Oko a Kolebu polyclinic no. How dey a free.
Yes.
Oko la general hospital no. How dey a free. O Eastern region na to say be a o akwetia o ya minor o akwetia. Oko St. Dominic's a hospital, a district hospital, a be free. Oko baby to say Abia Koforidia St. Joseph Hospital, and no a be free.
Yes.
Now say you refer to a regional center, you activate your national health insurance or your private health insurance or your medical savings account. Now
But are you by this saying, sir, the rigidity now primary health care system
on Asempa
FM out of pocket treatment they be 40% no. Say yes, escalated the call secondary health care. Rigidity ni be free.
Okay, so your question here, the rigidities within the national health insurance scheme.
Absolutely, our primary level.
Uyi the kosra.
Yes,
you understand. Uyi the kosra. What happens? They say expenditure and at the level of primary health care no. A free so. At this stage, or concentrate our secondary, that is regional hospitals and Kolebu teaching hospitals and other tertiary centers. The burden, financial burden goes down. And even in terms of also administrative aid, for instance, if you are spending about 30 to 40 million Ghana cedis to give cards, no more, any other day, all those ways, you understand? So we can look at the health insurance, but I want to draw that distinction.
Sad distinction.
If your burden, if you were taking care of people at the primary level, secondary level, and tertiary level, now aban say ukomu ebu, and now take care of secondary and tertiary. Me take care of the primary now. Say bia utia oma school fees, primary, secondary, and udu university and polytechnics.
Yes.
That is the technical universities now.
Yes.
Unkwana utia ukomu ubu na aban say debi. Metia primary there now. Where you a certain I burden be feel so you can focus. That is how we should conceptualize the free primary.
Yeah, but unim from experience, and yeah, as simple as you say it, because at the end of the day, so we share national health insurance scheme now. A month for etua premium. In the young premium now, something say okay, a buying and a was a boy. Ye tua premium at the aboa a buying with me taking care of your healthcare needs. And even with that status quo now, no, the challenge and it's a secure was a core service providers no into me enco. The biggest challenge on can you see mo you claim sakamo and this is even when a man for a boa buying kakra. And they also ye premium to yani BBF through at the primary level. A chunk of our people ewo. Where are you going to get the money from?
The answer lies in the earlier issue.
Yeah.
Have you averted your minds to the percentage of health insurance I see kana omunafi I premium? It's woefully inadequate.
Okay.
It's below 10%.
Okay.
The entire I percentage. The premium itself, the premium argument.
Yeah.
Does not arise. It's below 10%, sometimes even 4%. That is how small it is. You understand?
Yes, with you.
So that young confusing and for. Let me reiterate what free primary healthcare is for the NDC. Oko District Hospital, be free. Oko Polyclinic, be free. Oko Health Center, be free. Oko Chips Compound, be free. We here health insurance card.
Now they are
we here
private insurance.
Private insurance. Government aid to amount. Enti say o health insurance card the wo enwu yo bio wuni bio a private health insurance a national health insurance NDC aban yanko pardon eba in 2021 January 7 SA we are under free primary healthcare Oko hospital now tuya sika district hospital polyclinic health centers
and chips
compounds me pese me ma we very very clear
I think
because your conceptualization is viewing free primary healthcare through the lens of national health insurance.
No.
And if you are not careful, okay, you complicate matters.
I understand maybe
but now that you made way, I'm coming back.
Yeah.
Didn't it strike you, say, premium is that small?
Yeah, it's striking. I mean, say a small. But I mean, even if a small, 4% they are more kakra to government.
And strike you say a premium is asa.
Yeah, it's striking.
Very good. Until when Obi Honorable Minister Ebetinaha now rely so much with his argument on the premium. Now financing of health insurance.
No, I think his point was not me busa about it. Only point was say the status quo now, primary health care really free. That I think is his point.
My brother, Obi, one good thing about your school, Pobjon Secondary School and Junior Seminary, is that we are trained to be critical, analytical. How can primary health care be free for all under the status quo? Even if you fall within the exemption groups,
yes.
How about Omo Folly are within the exemption groups? No, Ombenya or the basket of goods and services that primary health care offer. You may want to take like immunization and those things out, but how about common illnesses. Assuming say you are 19 years. When you malaria, only health insurance card. Will it be free?
So only health insurance card no the 19 years. Only falling within 18 years and below.
Yes, a very free amount.
No, and when you're free amount.
Very good. And if a home minister betrayaka same way, my brother, Pope John, they taught us to be critical. Sometimes question them on this.
But the other thing is honorable and
baby, what did you make an
No, I want to know. It makes sense. I understand you.
And to know what you say near a minister can say. And you see, unfortunately, Mate, I mean, somebody that I expect him to know better
on Asempa FM
within the MPP. Me person me bonidi or a medical doctor has also made the same point. Say free primary health care, no?
Yes.
It is free. Cecilia Ayeka I have raised just one example for you. Obia the 19. Okay?
Yes.
When you're ABA typhoid, only health insurance card. Sani pano. A free mano.
But I didn't find out why a Sani pano. ABA only health insurance.
You see, again, Mami Shawade.
No, so what kind of premium are negligible and yes, it can be.
Mami Shawade. If you want an academic exercise on health insurance, we can do it. You may want to invite me on a day that's very free. We will discuss health insurance. I have read over 900 academic papers on health insurance. You understand? We can discuss all that. But what I want you to know is me best make us so much control. Among can cre entry Ghana for with some say it is free that is and then I'm person me de share
could see saying on Asempa FM.
Now listeners since so ABA omo dada omo say it free that no. Me mom who say any free that in any case health insurance now data say active membership no and below 50% of the population. You understand?
Yes.
And research and so actually be and I don't want this to become an academic exercise. Why there are barriers. There are cost and non-cost barriers. Normally in these things. Okay. Sometimes we make the mistake of just I think it's just a cost. Cost is true. And in fact, if you look at one of the earliest systematic reviews on Ghana's National Health Insurance Scheme. This was done in 2009 by two people, Witter and Gashon. Their conclusion, was about the financial and sustainability of the National Health Insurance Scheme. And just implementing health insurance from 2005 to 2008, at the time, just 3 years now, the amount of money now buying the then government, scheme, they put it at $34 million US. At the end of 2008, the first systematic review that took place on the National Health Insurance Scheme by Witter and Gashon. And this was one of their conclusions. Yes. In 2008, however, some major cash flow problems developed. As of the end of 2008, around $34 million US was owing to health facilities, according to the Ministry of Health financial statement. You understand? So this is a systematic review done by Witter and Gashon. I've told you, let's not make this discussion an academic work on national health insurance. Let me reiterate what free primary healthcare is. Free primary healthcare na ye kano actually say we are Ghana ni who health insurance card who need health insurance card and health insurance no and national health insurance ye abide the pay. It be a private health insurance. A case ya no money at the day. Okay. Medical savings so medical savings so. Oko district hospital. To say ABA Peki district hospital. La General Hospital. Oko polyclinic. Mamu bio Kaneshio. Oko Health Center, Oko Chief Compound
on Asempa FM.
A dainty and a yenisa. Yenisa, Sanya Ebeya. Obia Sorianopa, or say, Mitia Mea, Akache and Yere, and maybe an Ebase, I betia mea. na ebia ne oni sika ode be ko hospital ono so ha ebia oni insurance card and an insurance card no grandpa ebi grandpa eden ewu okọ also eni ma me nkọ afuo mu mra ana me nkọ adwuma mra na me nyesika kakra ebi o kire echi na ai mediko se na ebia niti no enye se ebia wanda yie enti na niti epai no ebia na hypertension na ama niti ni pai no because of cost barrier nti wanko hospital ana wanko chips compound crumpo na ya check ni BP na kasi BP de eja manu ma miesi BP no kosoro into we dey also call health center and I say also call polyclinic and district hospital ema a doctor for and a physician assistant show into wako okoye no onam kwan so sa sebio no wanya stroke atori mumu na sa nipa ya onisika nti 140 per year crampo anko no and the stroke and the kwa more expensive drugs or kwako occupy hospital bed which is far more expensive enti no anka oye free primary health care nipa no nitina pai na onim se me de kwa free ya so itina no ya hwe no say na say de no so em say too much stress ya ai home weekends home ye no doso ana ebia parties no doso so ya branch na bibia ebia anajo dakakra no moni ade ka we nyina ya cancel what change lifestyle ebia aduane so the foods kakra no moni ade because cost is not going to be a barrier at that early stage of the disease process ebeka could do a stroke ntino wako wenya sa ade we wasesa na brabo any lifestyle ama enunti wenya stroke no sa nipa na wenya stroke no beyond the cost state no embe say or dey take care of or no assume say our health insurance only health insurance nso ono ankasa ebeye ebusafo we pesika asori for we pesika e de ahwe no if say esa nipa nya stroke na all that money is going to be on Asempa FM say if say also yare na no dey in term the other side at the primary level and cost and your barrier emano into no utimi e contem. Another thing about strengthening the primary healthcare system as a strategy to achieve health for all. And they say, CHIPS compounds, when you're focusing on the free primary healthcare, the CHIPS compounds which are in the communities directly, take center stage, and so our healthcare system much more priority. In the year, say, you better developing more of them. And no. Yet to me developing more of them. Now yet to me expand it. Yet to me more community health nurses. Eduomuguha. Actually say, and your system just curative. Medical as a primary healthcare has a curative aspect. It has a preventive aspect, the promotive aspect, and everything. Community health nurses, they will cover a catchment area. Into among crop for a war. Ebia a might be crampona omafa a yefun wasa area immediately. Ominimum into ominim so ebia efiewemu nipa say
on
the linkages same place or midwife or registered a nurse and so on. It's almost like a mini clinic and within the community ombe so yare on them ombe to reduce maternal mortality and ma eko awo so a omu hypertension diabetes pneumonia ade ombe to me apeke no in
in all honesty, the benefit of Wayno is not lost out on anybody. No, I think that the real challenge, about my Musa question, the real challenge, they say beyond these beautiful intentions, because I know, say, the same issue of cost barrier, and I'm going free. In 2008, mo promise a one-time health insurance premium because again it's the same argument. Say, yempesi ebe burden amount for with the cost into utiaba and one you have access to free healthcare and ade. You came to power and realized, say no. The challenge is now quite enormous. In the problem no one time no MYA. The same thing, beautiful intentions. Moba, where are you going to get the money from to do what you're saying?
Without You see, don't assume, sir,
Yes.
the benefits of primary healthcare is out there.
You could see saying on
For
Asempa
instance,
FM.
what I've said so far, any tip of the iceberg. Let me show you another example. And they even creating more jobs. Near Aimakai, there's more nurses
Asempa
will be needed.
FM.
Nurses will be employed. Community health nurses. We will need more midwives. Again, Osha Baby to say, under our current system, physician assistants, they play a major role in the health center. In fact, say Usakrampona say physician assistant, you don't even know the difference between a doctor and a physician assistant because of their levels of knowledge. Senior obeshow any other identity. Unim say under the current system, physician assistant a prescribe a hypertension drew amount. Now a prescribing or a polyclinic and a district hospital, a doctor or and not the health insurance system, EBTIA. But the same physician assistant, eco prescribe our health center, hypertension, not say even our health insurance card, krumpa. The health insurance system will not pay for it. You understand?
Yeah.
Okay. These are some of the benefits that free primary healthcare
You could see saying on Asempa
whether
FM.
it's being prescribed at the level of the health center or the polyclinic or district hospital or hypertension. Na say enye polyclinic and a district hospital and a ben wa na a health center and a ben wa uko physician assistant a show na amount hypertension drug aban ebe take care of it. Another one when sometimes no you try kromucha na ye kaya pharmacies pharmacy shops ebia oko echire kakra na o ka drugstore but oko hinterlands no pa more na chemical shops chemical sellers no money ade under free primary healthcare. Okay, one of the visions that we are anticipating is say all these pharmacies drugstores, chemical shops, no money ade. We will engage them. Send your beya and conquer say a yendrope and omoye de omu dispense. Washa in the major pharmacies no me say almost 30 a day be alcohol yet me check you BP mount and ebia omutimi ye quick a malaria test, a rapid diagnostic test no me ade be.
You could see saying on
We
Asempa
have
FM.
to take it from the private realm no and say it's a good thing na omoye. And you know, free primary healthcare is going to support that. And so, what does that mean? It means say oyare maybe a drugstore and a community na wo ebia owo akrabia say uni major pharmacy like NS chemist and kina pharma no more near the those kinds of big pharmacy. But they said drugstore be ubetimi aboyerem because free primary healthcare nti or yet service I provider within a year algorithms no ho say bia we basin it here na ya mun check BP o check BP no this I level na say who input into a gadget e be kire say ebia refer na say immediately onco a health center and onco chips compound ni enhwe no enom ni ade. These are all some of the benefits that is taking healthcare to the people. Health for all means you are removing the financing barrier.
Yes.
1, 2, you are also making healthcare accessible
to the people.
And into there are places that Abia Chiefs Compound Crampono and Beno Health Center no Beno, but Abia
see saying on Asempa FM.
when we say Saturday manka, you will just take free primary healthcare as just a free primary healthcare, but you won't also
maybe a
identify
drugstore
this
ne ben ni pano.
benefit.
O say obe rema kwa kwaji e draw
At
free.
least no urem you tell what is wrong with you.
Yeah.
Basically, they will do your checks. Those
Checks,
BP.
Yeah.
No money at the other.
Yeah.
Because of IT systems, the gadget that accredited shop no will show say if the BP is this refer the person to a health center, refer the person to a chips compound, refer the person to district hospital. So that becomes a quick response. You have taken healthcare to the person.
And some infrastructure in terms of our gadgets will be available to them.
Exactly, because they will be accredited agents of the free primary healthcare system.
Free primary healthcare
so
system.
basically, what it will do is say, and taking out the pharmaceutical industry and the chemical selling industry, and so from the health system, they also have a major role to play. It will create more jobs. You think that you want to go into private practice?
Yeah,
you can also decide to set up
a pharmacy, a drugstore, a chemical
or a practice.
Okay,
that can also offer free primary healthcare. When it will even reduce infrastructure burden on government. Because buying they see a hospital or if the private sector a pharmacy shop or a drugstore shop and they are helping to offer some of these services and the people are having it anywhere. The pressure on you say you need direct access to healthcare into Brabesi CMI, it will reduce it.
Okay.
We want to make this argument to show say even though free primary healthcare comes with a certain expenditure expectation, there are also aspects of it. It brings down expenditure.
The burden on government. Okay.
And the cost of illness, the cost of a disease.
Yeah.
Professor Asenswatre, nakupon fan the currency, work on the cost and burden of a malaria. And they looked at say be a teacher ni and now work be a malaria no money at the day. If say unya a malaria na on school control parade obeko a hospital a hospital na the time obe spend the hospital crampansa na when your card ako doctor from doctor if say a doctor ko help patients or ward answer na anopano oba consulting room what answer the be no almost the whole day is what is gone.
Yeah.
Okay.
Yeah.
And OSHA, the latest research now is pointing to say waiting time in a hospital is 161 minutes. That is over 2.5 hours. And if you can use free primary healthcare to reduce the number of people at a big hospitals OPD, because what strengthen CHIPS compounds, what strengthen the involvement of pharmacy shops and drugstores in providing this kind of care. You are also making it easier for the people say they can quickly go to this place.
I think the next 2 hours to me am my benefit of this. I mean it's not in doubt. The point still comes back, say, how will this be funded? For example, are buying and answer the NDC should be able to tell the Ghanaian people say calculations 4 years they be buying first year primary healthcare implementation because you need numbers so data na Hong Kong for hospitals you bet me a steady trends Eddie ebe cost you say because the intentions are good. And mama example, when you had a similar beautiful intention mobile you couldn't do it. Even after someone making a flagship promise.
At the time, okay.
Yeah.
President Mills's administration had a major policy or inherited like the single spine. Okay.
Yes.
If you refer to a President Mills, the NDC administration had not promised single spine.
Yes.
Obekaya at the time President Kufuor Efiaban, one of his last minute was to increase salaries. You understand? Those gave some shocks to the Mills administration at the time. Okay. I will not use the same argument. And in fact, that should also let you know that in trying to deal with
on Asempa FM
health for all, if you over focus also on just the national health insurance, okay, you may not be able to achieve it because one-time premium was about national health insurance.
Yes.
This one is not about national health insurance. This one is another tool another system that is being worked on
Yes.
to come and augment. So I want you to.
But Ninina no aim to remove the cost
equation.
barrier. Because
not just
premium
not
one,
just the cost. You see, not just the cost barrier. You see,
which is critical. Cost barrier and also critical. One way other benefits, no? But cost barrier now they start.
You still have a major conceptualization problem.
Yes.
With free primary health. Let me tell you. Let me.
You started off by saying on the benefit of primary health care, no, your first thing was to remove the cost barrier. So now the other way, no, ever.
So does that mean that is? Let me help you, Obi. The effect of health insurance, if you take health insurance, okay, it is to secure yourself against future costs of health care. And that is why I'm saying that if you view free primary health care through the lens of health insurance, you will still be making the cost argument.
But the cost is essential.
It is essential. But if you don't also consider the benefits, you will know the cost of everything and the benefit
and the value of nothing.
But so I'm telling you that
yes,
your concern is about how you are going to fund it. And I'm telling you that we have done detailed work on it. Okay?
Yes.
We have done detailed work on it.
In the first year, first year of implementation.
Clearly, you have not even been listening to the NDC on free primary health care. If you've been listening to the NDC on
but you are here, and some you are the spokesperson on health.
Maybe if you have been listening to the NDC on free primary health care, you will remember, say, President Mahama, by the end of 2021, would have implemented
2021.
Exactly. You understand?
Yes.
This shows the kind of critical thinking that has gone into it. That it's not like, say, Unya winning election.
Now we implement it.
January 7, now we implement
it. On Asempa FM.
So the work that has been done, and it's here. I can show you.
Okay, meaning Nyame Aduna win ne bar. You take the first year, no, to smoothing the rough edges.
No. The implementation will start before the end of 2021. Yes, that is what President Mahama said.
By November 2021, December 2021.
Yes, you should expect implementation of free primary healthcare. If you want analysis of how it is going to take place, okay, it is right here all the way. There is implementation in year 1. It's implementation
in year 2.
Year 2. It's implementation in year 3.
Funding sources consolidated fund.
It will be coming from consolidated fund. That is 1. 2. You will also raise some money also from the ABFA also to assist that.
Oil annual budget funding support.
Yes, and you see, if you look at the total cost of this, it will amaze you. It's not that much.
Okay. From numbers,
maybe I don't. It's on this spreadsheet. I don't know whether I have the authority to be
a spokesperson on health. You can put it out. This shouldn't be a
certain
problem. At least some level of credibility.
But
so
at least,
it tells the people that you know what you're talking about.
You see the red?
Yeah, I've seen it.
Year 1, year 2, year 3, year 4.
I've seen it.
Very good. So I'm not hiding. You have seen this spreadsheet.
Whose spreadsheet?
You've seen it.
Yeah.
Okay. These are the assumptions underpinning it. You've seen it. Okay.
Yeah.
So and let's see, I promise BKK. Okay. Yeah, promise BKK. It's all here. Year 1, year 2.
But for the credibility of the promise, no, you should put some of these information.
The promise already has a credibility. The number of people who are expressing interest in it, okay, the promise already has credibility. I can assure you, it has credibility. Right from the word go. Because people have identified with the free primary healthcare. And what is it? Sorry. Let me
because of time. They are spending almost an hour on free. You have a lot
of
things
free primary health care. Oko District Hospital is free.
Yes.
Oko Polyclinic is free. Oko Health Center is free.
And a Chips Compound.
Oko Chips Compound is free. But no them person just say Obiara in terms of cost now. How no? Material is here.
No, but on fan too.
Very well done. Okay. I've shown you. Yes, you can see the numbers. Okay. And
the numbers. My point again would be,
Obi wants to be the first person to extract.
Look, my point again would be, sir, you raised a very legitimate challenge at the Mills administration in 2009 when they had to implement, single spine. Because
let me add another one to it. Okay. Again, at the end of 2012, Ghanaians decided that the Mills administration had performed creditably well on its manifesto. Okay. Okay.
Yes.
And the NDC was given another mandate. You understand? This should tell you
despite not fulfilling one-time premium.
This should tell you that Ghanaians also did the math and looked at the monumental increases that had gone on in terms of salaries because of the single spine and other interventions. You understand? So, for me, and I've heard it and I can understand, you are re-echoing a certain MPP mantra. Their first one is about national health insurance. I've proven here that argument about national health insurance that they are making are flawed. Okay? Their next one is about one-time premium. My brother, free primary health care is coming. Free primary health care will stay. And free primary health care will ensure that if you go to the district hospital.
Semu take over from 2021.
Yeah, inshallah.
Our country is in...
Inshallah.
Inshallah.
Amen.
Because of COVID-19, even more dire. Because the economy is projected to grow by 0.9%. The finance minister said will take 3 to 4 years to recover. With this, now, how are you going to implement not just free primary health care, but in this manifesto, almost every promise you've given the Ghanaian people, hugely capital intensive.
Mistake be in your questioning.
Mistake be.
And
mistake be.
The question is because of COVID-19. Into Ghana economy is in there.
No, we are projected to grow by 0.9%.
Before COVID-19, not Ghana economy, no, at the
let me grant you that. No, my main grant you say
it's not you granting. No, it's not you granting.
For the purposes of this,
you want the figure. No,
let me even tell you, sir.
You see, Obi, I don't want you to regurgitate.
I am not regurgitating
the MPP's framing of things. I put it to you.
Yes.
That before COVID, this economy, not at the
The question I'm making, the question I want to ask you is,
they had overboard, with very little to show for.
Economy how can it fund all these promises, including free primary health care?
Make sure article be about the national debt. And I'm a bar who studio her. Sabina Misha mask. And I Misha mask.
Not COVID my.
And I Misha mask. Do you now agree, say, proud to I COVID? Not this economy.
And I may say, let me grant you that.
No, economy saying you are granting me. It's as if saying you are making a so. No, because you want to move on, so you are granting it. Because what you have to.
No, the point is,
no, what you have to say.
The figures as far as our GDP growth is concerned.
They say they are They say they are say economy. No, you see, because
but economy has say no. How would it be able to fund all these promises?
I was say Obo on Semayeng.
Say
President Mahama is not just making promises just like that.
You could see saying on Asempa FM.
Say this one, the implementation will be towards the end of 2021. Which careful thinking that he's not just making say on your promise be akeke. He believes by that time not with me a healthy bleeding points be. Building points in the saying, Massa, the top heaviness of this administration, appointees, not just about ministers, but also about a presidential staffers, no money at the Adinara. What can say about be here for? You understand?
But that alone cannot fund $10 billion big push. And now no Sami Jenfi bet now. Ubusan $10 billion. Maybe Omenyas can if you also can the same thing. Say mobile limited administration and all of that. No. We are staying with.
I'm noting it down. Okay, since you've raised it, and since you've mentioned the name of my indefatigable national communications officer,
Yes.
brilliant guy,
Yes.
brilliant guy,
Yes.
okay,
Yes.
Obi, $10 billion at an exchange rate of 5.8, Sabri,
Asempa
58
FM.
billion
Yes.
Ghana cedis.
Yes.
Mebwa.
Yes.
MPP in less than 4 years.
FM.
Okay, national debt is now over 250 million. All the other hidden debts can they are now about 300 million. But those are hidden. You are about months on Albin. Intino, who take debt at 120 billion. What page up to over 250 billion. It means that within a matter of less than 4 years now, borrow about 130 billion they were borrowed. If Big Push is 58 billion Ghana cedis,
Yeah.
isn't it less than the total amount that MPP has borrowed?
In the point, they say you would also borrow to
No,
fund this.
listen, isn't it less than the total amount that MPP has borrowed?
It is.
It is. So do you see that if you contrast the Big Push
Yes.
to the total borrowings of the MPP, okay, in less than 4 years, it becomes a minute fraction of it.
In the meaning, say you
Okay.
are also going to borrow to
Listen,
fund this.
listen,
Because MPP
listen.
borrowing and that one time.
Listen,
Yes.
NDC has never been hypocritical about
Asempa FM.
the management of debts. Now, yeah, can I say, Ubura, okay, fire be to say a trouble gas infrastructure.
Ekusi saying
A trouble gas infrastructure until ene LPG gas a menewo ye de no aduane wo fie.
Yes.
Emma e de ye aduane. Emema e de ye niema bibre. We used to have massive shortages of LPG gas.
Yes.
Because of a trouble gas infrastructure and yenisa. Because of a trouble gas infrastructure and there were other forms of gas and so many other day. And this is foresight in what when you borrow you use the money for. You understand? See, and you say borrowing, and we said this. Brian 2 MPP 4 yawa baimu omantie. Say na buena yet is so come there and I have been at the Bank of Ghana before and you say catch them say look, it is what you use the money for, so that the money a bit me generate sikakron pay bit me. And nothing like one of our debt management strategies. We are very, but I'll come back to my health thing. One of our debt management strategies was what we called on-lending.
Yeah.
What is on-lending? On-lending means that ABR, Ghana Water, a water project. Obobesia, Odiama Ghana Water, say fire water project. Say Ghana Water, a water project.
Ekusi saying on Asempa FM.
So you guarantee for Ghana Water. Ghana Water, a revenue. Na Ghana Water, service debt no. It is our debt a servicing no. And be burden on Obi. And I say Omaneboama. And I say a question. Ghana Water is responsible. It's just like a private company. If there will be a guarantee loan amount. That was one of the policies that we were implementing on lending.
Okay.
Another shining example of that, a Terminal 3, where Yama Ghana Airport Company Limited
Borrowed
on their own books.
Okay.
And nothing is that debt, and ya dear men, you try taxes, near the other day, yet the Aquacutia is
Yes.
Unfortunately, Yanum, Yunyanumi, dear. Ama borrow says over 130 billion. And so, Ubisa say, what are those kinds of the trouble gas infrastructure, the Terminal 3, the massive hospitals that can even generate so that is the difference between
But even when they adopted the strategy of yours, Mebao, say creating special vehicles Omonsu betimi e borrow into the Esla example.
But Esla no,
you created it. That's not my question. That's not my question. That's not my question. That's not my question.
Because
my question and
when they adopted,
hold on.
Esla no, yen. Exim Bank,
yes.
Yang and you created the Ghana.
But that's not even my question.
Maybe you created the Ghana Exim Bank,
yes.
and then the Ghana Exim Bank here.
Omode funded 1D1F, no?
And then be able to know there.
I don't know what TBB.
Releasing monies to all kinds of way for what to promote What?
Like ambassadors, Nidiana.
Yes.
What's wrong with that?
What is wrong with that? Why do you have to use that kind of money when you have SMEs who are still looking for money, okay, to expand their businesses so that they can export, to produce more? You understand? If you have excess money, why not? You don't see anything wrong with that, Obi?
No, I'm asking you. I mean,
No, don't
I'm
you see,
you.
Obi? Look,
Honorable Omanebo.
Obi, your school, our school touch our hearts, not just our heads. You don't see anything wrong with that.
Honorable
And you know, what I'm saying is, you see, you brought in this at 10 billion. So I've explained to you that the $10 billion thing, it comes to $58 billion.
Yes.
It is way below the over 130 billion that the MPP has borrowed. That we cannot see a project like the trouble gas infrastructure.
Yeah.
You cannot see a project like the Terminal 3 and those ones. But again, ours is not even about reckless borrowing. When we borrow, we make sure that we invest them in projects that can repay themselves. And some of these ways, or we also not just even be about government this way. It be BOOT, where a private investor can come in.
MN, your friend is saying, the port.
Yeah, the ports.
The port arrangement.
Put real infrastructure there and then
toll it, more like.
Toll
as a road.
And you know, Anokrapo is not going to rest on just government way. Enough of the intrusion of your 10 billion. You know. So I hope I've been able to explain it for you to know that when it comes to debt management, we have a superior approach to it. We told the MPP, they cannot tell me one innovation in terms of management of Ghana's debt.
My only challenge with 10 billion is thus far, it's not captured in the manifesto. Maybe manifesto need to mean capture BBR. But specific ways, okay, 10 billion. So far, okay, you bet me, you bet me, 10 billion. That's what you've done.
Obi.
Now,
a manifesto.
Yes.
No,
but that's the same thing I'm saying.
Exactly.
Yes.
And so I've told you that, okay, 10 billion, you want some for infrastructure. We know where we get money for roads.
Yes.
We know where a trouble gas. Okay. That was a Chinese
facility
funded project.
Yeah.
The T3 was a Turkish project.
Yeah.
You understand?
Yeah.
So I'm telling you, do you doubt that it is possible for a government of Ghana to raise 58 billion Ghana cedis when the government of Ghana in less than 4 years has borrowed 130 billion and there's very little to show for?
But you asked these questions of the opposition then. Say free SHS, the Mubenyes ka when they are funding. They told you, say, corruption, corruption, you doubted that. So why should we believe you if you are saying the same thing?
I'm not saying the same thing. I will not give that mediocre answer. I won't say the same thing. I've told you.
What can loopholes?
I've told you consolidated fund. Okay. I've told you the ABFA.
On
answer.
Asempa
And I'm cutting down on the top heaviness of this administration. So at least I mentioned consolidated fund, I mentioned the ABFA, and then cutting down on the unnecessary recurrent government expenditure.
They told you they would use oil proceeds to fund it.
If you
doubted them.
We doubted them, but they have used oil proceeds. And in fact, if you look at free SHS, okay, the total amount of projections that they have made in their own budget, 2017 to 2020, up to 5.6 billion. In 2017, 400 million. 2018, 1.2 billion. 2019, 1.6 billion. 2020, 2.4 billion. Total 5.6 billion.
Yeah.
Okay.
Yeah.
If you look at the total revenue, okay, that their own budget statements were anticipating for 2017 to 2020 from the oil and gas sector, that was 20 billion Ghana cedis. It means that they needed just a quarter
of
the oil money to fund free SHS. So for free SHS, that they even make so much
noise about
it. Okay, the oil wells are President Mahama. At the time, just a quarter of that can fund the entire free SHS. So assuming that we even decide, okay, and even you won't need up to 5.6 billion to fund the entire free primary healthcare. I've shown you the detailed work that we have done.
Yeah, but I've not seen the cost. I mean, who figures?
But,
So
but
it's difficult to believe what you're saying now.
I mean, Obi, you cannot say that you didn't see the.
No, but who excels? No, but I mean, who?
But I'm telling you that it is way below 5.6 billion. You understand? But the impact is massive. So I've told you that you can get it from Consolidated Fund.
ABFA.
Okay. Part of it from ABFA.
Okay.
Another one is to cut out the waste. Why do you need 120 something ministers? Why? What is our population size? For what? And then you have ministries like monitoring and evaluation. You have a ministry that is monitoring, and then you go and put ghost project, non-existent projects into your. What was the ministry monitoring?
But in your case, for example, in who case, time our communications minister, two ministries were merged.
Yes.
Some of the information that count. It's heavy in Sekabi. Because the staff at the information ministry were still being paid.
On Asempa
the merge communication, any information.
Yes.
More communication, I'm one deputy minister. Not information, were one minister. Honorable Mahama Yariga.
Yeah.
From 2013 to July 2014.
Asempa FM.
Okay. Now, Honorable Felix Kwachi Ofosu was a deputy minister.
Yes.
And Honorable Mutala was another deputy minister. Okay. Ye ministry ni fi hono. I the bar information. You get the bar communications no. Only Honorable Kwachi Ofosu and ebe joining
were communications.
Communications.
Emma we had two deputy ministers.
Yes. Into at the time, Ejuma na nipa 5. And na no. Ebe ye nipa 3.
Yeah.
And na
Yeah.
As a result of that reshuffle, Ibinso went out of government. Into no, someone like Honorable Mahama Yariga went to, I think, a Ministry of Environment at the
Science
time.
and Technology,
Also.
Yeah.
And then Mutala also went to either
trade as deputy
or employment, one of it. You understand? So that alone, that realignment alone, reduced the number.
How did it?
It did because some people
because Ayariga was still a cabinet minister.
But some people went out of government.
Who? No, in your case, the two ministries, information ministry, apart from the two people are free, all the staff of the because I'm on the chunk.
But what's it?
I'm on the chunk. The civil servants.
You don't know what you're talking about.
Why are they not paying
the cost of S gratia? One S gratia. Civil servant after working for 30 years.
Yes.
Okay.
Yes.
Oko pensioner. Ahena lump sum.
So your point is?
My point is that never underestimate the expenditure of the state
on ministers.
On ministers
and their deputies.
And that class of people.
Article 71.
And that is why I am worried that President Akufo-Addo will do that. Obi, we can have general political discussion.
Or health infrastructure.
So I'm back to
health infrastructure.
So now, wrapping up on free primary health care.
Look,
I know.
And I know him overarching.
Obi, no, it's very important. Wrapping up on free primary health care. Free primary health care is a debano. So we are Oko District Hospital are free. Oko Polyclinic are free. Oko Health Center and Oko Chips Compound are free.
Okay.
Other people are going to get jobs because you will need more nurses, you will need more community health nurses, you will need more midwives. We will need drugstores and chemical sellers and pharmacies to also help in this.
Okay.
IT people will also get jobs in it because the automation also even in terms of auditing the integrity of the health system. Kanana a cost within the health system.
Yes.
This automation is also going to help in tracking. The audit system will ensure say hopefully by Sabrina now Mr. Domlevo are returning from the long leave. President Kufuor.
Okay. And the health infrastructure, Doc, must say progressively transform all regional hospitals into teaching hospitals. Progressively. Meaning, I don't know, timelines be unshed in home. But continue and complete health facilities abandoned by the NPP government, Tepa, Akachi, Kumewu, Abetifi, and Garu, And I must say, you will construct 2 police hospitals in the middle and northern zones.
Yeah.
You would expand 37 military hospital. Must say, you will construct CHIPS compounds in electoral areas.
Yes,
You could see saying
And
on
that is
Asempa
feed into the
FM.
free primary healthcare seminar here.
Yeah.
When we said there's policy coherence.
No, but electoral areas, you will see saying how
Yeah,
many.
electoral areas near about 6,000.
And you must saying the what CHIPS compounds is here.
I would have to check the exact detail.
Then we can have that.
I
that
have
way.
the number of
Okay.
this is certain
In your more, it will be no,
Or the-
and then we know numbers are accurate, so we
Exactly.
can hold you to
Yeah.
that.
Oh no, don't worry.
Yeah.
You see, our promises no so succinct. Now if amount for no honso ne buy. Into no, and nothing ama your manifesto no. Amount for assumes no.
Establish blood banks in all district hospitals.
Mama explain that no. You see, we establish blood banks, okay, in district hospitals that don't have them to at the level that we expect.
Yeah.
What it means is say obi ehia moja den anya afi na okwa rely on obi and ohwe ikrampo sika sabri abai say e drones ho and one of their top things are omuka and they said drones no at the blood echo baby.
But that's true, no?
It is true, but if say ube to me blood bank investment are here now here to do a blood bank. So if you are spending about $12 million,
on
$13 million
FM.
on drone service at the end of the day, a recurrent expenditure. Nipa no first can put the account chrome. Why don't you establish a blood bank? Okay, to employ more lab technicians, more hematologists on my way to oversee a selected a district. So we think say can't health for all. It has to be accessible. I was say accessible. Accessibility didn't just say hospital no peka isi ho.
So meaning say
say
you discontinue with that drone policy.
No, I'm just using that as an example. You understand?
Okay.
To let you know how some of the things are almost how to say dry, you know. Sanka almost they would have created rather these blood banks no money are there in strategic locations so that it will be accessible to the people instead of clapping. You see, and that is what when you look at health system performance and measurement, you see that sometimes the things that you focus on and say that I've done this, I've done that, and clap for yourself.
Yeah.
You know. If you don't look at the alternate use of that resource, you make a mistake. These are unintended consequences.
Oh, okay. Okay. Inti Dr. Omane Boamah na meneno AD Nkomo or spokesperson on health, former deputy communications minister, Republic of Ghana, and Kasa. Inti you go through a manifesto and some of the policy proposals, a woman, some promises and so a woman.
And maternity leave yes adama kuma so yi me pese me ka ho asem obi
Enra Dr. Mustafa Ebo commended you for that promise of extending it by 1 month. But he made a point say eno nye the most critical need of women in Ghana.
Minia Penny Mustafa onim say there are so many things that affect a man. Your address was a manifesto. I agree, say he has to find a way to criticize. But when Eka say this is the most critical need, but it is one of the needs of women. Minia, ma ubin dada. Se oba after your 9 months.
Yes.
To go through pregnancy. Now, okowa ebi krompo na ne can say wa normal a vaginal delivery. There was nothing.
On
doctors and cut and I say that there was no tear, no episiotomy, and I say no tear, no isolation taking place. Okay, completely.
Yes.
When the cramp between the time we could do hospital, labor no ever cost for dilatation to take place up to about 10 centimeters. Akarano, you be who say I know you're checking the sugar, BBI you're fine, and sana you see mama radio ubeti me any akarano akofie it you know. And you be cry not 24 hours there then echo. Okay.
Yeah.
So 24 hours here echoing. Say mama ewo a baby will fear akwara because will be all there definitely ne baba ko ka may not be an adult because the woman must be in a reproductive age group. Until be obewa akwara, e be crumpo no crumpo kindergarten, maybe or class 1, class 2, class 3, no money ade ade. Media no ever be see the paternity leave extension so. But when I finished,
and also it's like 7 days,
yes,
right?
And it's 7 days. And sir, 7 days no is to make sure say if the inquiry be sir will fee and I'm at that time up a hospital. Papa no ebe timi enya time obe den obe pay attention to if so because most times no we ignore that one. We expect say an angel ebe fee asa a papa no e den e ko adwuma. Nya mesre say sir paternity leave in a bar papa for mema yemfa trafie na yemfa nya adwuma aban expect say ye be no. But the maternity leave, the woman has gone through this. Or breastfeed akwara. Ebia or other inquirances or ebi cramponso na ye in the surgery. No money ade ade. After 3 months, you expect to say obekwa adwuma. Unim say most of the time, ye maame nom, ye yere nom, ye sisters no. Their strategy is say omo do omo annual leave. Omo je e de ka maternity leave no say na ebe ya ebe to aso. So that the 3 months no na ordinary annual leave ebia 1 month and 6 weeks at their so say na ebe pushing it to be about 4 months and 2 weeks. You know, in fact, when we were discussing it, na your option, your paper was 6 months. Because our point was that we in 6 months now, nanka coincided with the exclusive breastfeeding period of 6 months. But we hit a snag. What was it? The private sector, they had a consensus, say, to be frank, in principle they agree, but it will also affect
productivity.
So there had to be a kind of accommodation that, okay, Oko insisted on 6 months. Now, almost okay, what the 6 months about? Next time, I'm employ in Crawford. If they decide to reduce the number of females that they will employ, it will be difficult for you to be enforcing, going around every private sector. Why are you not employing more females? It will be an unintended consequences of your insistence on 6 months. Michelle said this manifesto, we did a lot of consultations. So what we said was that, okay, an accommodation, let's do 4 months. If you do 4 months, not on no leave, no, that is about 6 weeks leave, no, at the count 4 months, no, the person is almost approaching the way 6 months, no. Into no annual leave, no, waji at the account 4 months, no, and that it's now year, and so there was a compromise. Who knows? Maybe as we develop now, you see come more as we all mind, it should be possible. Say one day, government will say, Mayor 6 months, private sector, can you pay for the 5th month, and I will pay for the 6th month. You understand? Because the burden, no, but it's not complete. It's not complete because it means that Obano wo na Oman 4 months now, or the annual leave no eka. She said that whole year no only leave BIB. And that is a major strain and stress also on a man. So as a social democratic party, I care about Nipa ye day near the other no. That was one of our major considerations.
Doc,
you know, maternity leave no 4 months. Paternity leave 7 days. Yes, right. Yeah, you know, leave no wojia.
Fatinefie.
Obi na the national ombudsman to check
for the 7 day paternity leave.
For the 7 day paternity leave. Another thing, also, which is I connected to the media. Now, mamimbo I media for Abaso. In terms of Obi, many times, Mokofa to say beer, Obia or Yari cancer, and now Ebia kidney BB.
Not yeah, Pacha Omano.
Namu Pacha Omano. No money at the day. The downside of it is what I call in English human degradation made so bestial.
Yeah.
Sometimes no pictures. Nah, the whole
That's splashing all over.
distended abdomen. Understandably, because you want to court the
Public
sympathies
sympathy.
of people so that they will do what? They will
give.
contribute. Yes, it's a great thing. And in fact, we want to harness public spiritedness of our nation and of our media to set up a cancer and kidney disease trust fund. Trust fund, you know, say key stakeholders and consolidated fund, they are buying and control how it should be used. So key stakeholders will be the people who are administering the trust fund. Buying a discabigum media, and so will form strong partnership with you for you to raise constant awareness about the funds so that people contribute. Into Obi area, even if you approach, let's say, multimedia, say, multimedia, we are all in this partnership. ABA,
on
from
Asempa
Giba,
FM.
who is on the board of the trust fund, and Nipa say, so you apply to the fund, they look at your condition, na omabua, oma support you. This is because we see these diseases like hypertension, you be declared as a national emergency because hypertension is a kidney disease is a even before you come into government. I mean, some is bitters, pneumonia, yeah.
I'm for
I mean,
moderate, you know.
Okay, now, you are asking for what they may not be able to do, but the moderation.
Funny moderation.
So helps pneumonia that they make sure say FDA approved.
Okay.
Send a obey offer and conquer say kidney be. Another thing still about human centeredness. Ya mama nom, ya papa nom. They say me wo obi nurses obi oye adwuma o bank no money ade. Once you approach your mid 30s, late 30s, early 40s, getting to your early 50s now, definitely na kupon ya dom na say u parent alive on it's likely say on pension.
Yeah.
Ofie baby ote enye one won ete. O sorry a o drain no say we akwara panko ade a te say me a o drain no say bia sabri ho na ehwe no enomoni ade ade. Ya feel say as global development so your mind so you be yenim no we have a more aging population say na you be hwe your maame nom ne your papa no mu a omanyi untimi nka say ebia lawyer bi enjoy ne law na or practice na onkonkotena ebia ekura maame fo ne ade so obankran krompo kakra bi krompo na osan say obesa akoback. And we need to formalize the system and provide domiciliary care. It doesn't mean say yes, sir, homes, because the research shows say that doesn't sit well with the African culture.
Okay.
In fact, abrofu krampono near ubenyano on pese obeko home. You understand?
Yeah.
And this should be a system. Yebabe training in Crawford who are interested in providing such a domiciliary care. And what training in health, they go and do such jobs. And what training they will provide that kind of service through a public, a private, a partnerships. It will also, whilst you are generating jobs for a certain critical mass of the youth, then also ye share ye maame nom ene ye
impanyefo anenso
ye nkwakra no yi eno ne domiciliary care we na ye kan ho asem no na ne saka ho bi ma ye pension for ene say NDC aban eba every year there will be an additional month what you may call a salary. We call it 13 month salary in the corporate world. Wajo January to December salary, but for every year no there's an additional month. The amount we want to introduce that into the pension thing. SNIT AAB during I think one of the anniversaries when we were in government, but that was a one-off thing. We want to have permanency for it. Every pensioner, every year, you will get an additional salary. Now, almost a contribution on my year. ama yaman you know.
Etimi omotimi nya ho mfa so.
We are recognizing and saying say yadamo ase ayiko say na mo hwe yen. Na omo nso a omo ye SSNIT contributors nso omo nko pension. COVID ba yi yemisa ye ho say private school teachers. Omo asitrem mu te sen. Nya ye kan say obi a private school teacher and I say obi a SSNIT contributor not suddenly BBSC into unya income, the person should be able to fall on
the SSNIT contributions.
Contributions.
Okay.
And that's okwa ko yini nyina de na mum kakra bi. And obi so contribute to a certain point.
And no will mean you would amend the law.
Definitely.
You would amend the law.
In fact, in the way no you can say you be amend the law no. Na ebi so no oh yeah. No I say bi assume say wa contribute to a certain point. Can you use that as a security for a mortgage?
Mortgage for a house.
We think that we should.
Doc, my final question to you would be again back to the credibility of some of the promises in there. So,
promises mean now credibility.
Hold on. Me take you to
promises
2012 manifesto. Because that was the last time I must ever about 2012 to 2016. And the things you promised to do for its next term, the NDC government proposes to, in the more increase resources for the training of medical doctors in order to reduce the patient-doctor ratio and the long waiting times in our hospitals. Double the number of community-based health planning, that's CHIPS compounds, from about 1,006 to 3,200 to meet the needs of underserved communities. Establish new district hospitals and more polyclinics in each of the 10 regions.
We did a lot of...
Establish new infectious diseases management centers. These things were not done. Why should we believe you this time? Because Marcia promises had any manifesto way.
You are better than
infectious disease centers.
You are better than this.
Infectious disease centers.
You listed so many things and you said that these things were not done. It means that someone who is listening to you will take all these things here, and say that we didn't do them. For instance,
infectious disease centers.
If you take the polyclinics, we did so many polyclinics that even this government has appropriated some of them to themselves.
Must more polyclinics in each of the 10 regions.
More. We did so many polyclinics. Osha district hospitals. We did a lot. I mean, one of the shining examples are unfortunately Yemianom MPP for this a of their manifesto. Almost their shameless achievement. Say Dodowa District Hospital.
Oh, Shayo Sudoku. No, understand the neck NMS hospitals now.
You also come achievements, you understand? Hospital. I mean,
but you named just one district hospital.
Will you doubt? Will you doubt an NDC administration that says Yababisi hospitals?
No, I must say infectious disease centers. My promise them will be two. But you had it in 2012. You did not build even one.
CHIPS compounds. Okay. CHIPS compounds.
Yes.
Unim said President Mahama Abaimu. Okay. His ministers were making
more contribute to the CB
deductions.
And almost he's saying,
I have to get those numbers for you. But even in terms of CHIPS compounds, Yankasa, the administration, government, not near out of pepper, the DC year we built over 1,000 of these CHIPS compounds under President Mahama. The overall effect is that the alternative, that is the MPP, in this context, when it comes to health infrastructure, okay, do you think they will even want to debate us on health infrastructure? But for NDC, would the Minister for Health have said he was resting at a UGMC? But for NDC, and COVID, in Ghana,
they saying on Asempa FM.
Rather, we should be interested, say, Abain air burden Senyara, January 2021. Obama abandoned hospitals like Kumawu.
Is it abandoned? Like when you say abandoned, what do you mean by that?
No,
abandoned. Just say you may be
a video. Will you challenge the chief?
When was that video shot? When was that video shot?
So you are saying that it was abandoned and that
no OCCC and you are coming to complete abandoned project.
Are you saying
we are speaking in the now?
Are you endorsing the kind of abandonment that we saw?
I am not endorsing anybody. I'm only asking questions. What abandoned that? What do you mean?
Your questions must be contextualized. Yes. Don't you know that Sankabainwe at the ahoden call a Kumawu a hospital.
Yes.
Tepa hospital.
Yes.
Okay.
Yes.
Even UGMC. Omo baye. Enka enye logo legenum ni ade omo ye anka UGMC would have operated at full capacity long ago. Meboa, masa. When it comes to health infrastructure, okay, MPP comes nowhere near us. In fact, a DB infrastructure na MPP will come anywhere near NDC. Is it the ICT sector? The Eastern Corridor Fiber I project over 800 kilometers from Ho in the Volta region through the Oti region through northeast to upper east in Boko with a link in the northern region from Yendi to Tamale. The National Data Center, the Accra Digital Center, and all those. Is it roads, the Kwame Nkrumah interchange, the Kaswa interchange, and all these? Which other sector can they? In fact, the details show. Dr. Bamian this idea we buy. Otherwise, it was not really an issue in the debate. Health expenditure on infrastructure as a percentage of GDP. Dr. Bamian the buy. If you look at it, notwithstanding the over 130 billion Ghana cedis are omu aborono, their record is abysmal. Yes, say yende yeba at the amambu Ghana for ebenya home faso. Ghana for nyina ebenya home faso. Not a government for a few. Not a government that ebe cookie deals in tax havens like a Japan. For the secrecy and all that tax havens bring.
On Asempa FM.
Government cooking things like PDS, no money. That is not what we are coming to do. We are coming to put in place quality leadership of integrity. Ebe making sure, say, specific on the health sector, we provide health for all, with free primary health care being one of the major interventions Ebe deliver. You go to a district hospital, it's free. You go to a polyclinic, it's free. You go to a health center, it's free.
In that,
you go to
in that new NDC government,
free. You go to
my friend Dr. Edward Omanebuama will be the next health minister.
No. I mean, so my brother, all we are saying is that NDC manifesto, ye dagana papa. If you say, and ye Ghana for and can manifesto, and the manifesto is organically linked to the hearts of Ghanaians and their minds. It's a manifesto no among for some.
I mean, kind messages kakana, sorry.
We say na December 7. Ghana for and to Aba.
Let me read some few messages now. Sorry, we say, please let Mr. Omanebuama know it should not be because of their free primary health care. They will start giving us unnecessary transfers from CHIPS compounds to polyclinics. So, Nana Mponsa Bedi Akodi and
polyclinic itself will be free. Nana Mponsa Bedi Akodi. One take. You see?
Oh no.
I
mean, kind messages and then you wrap up now. Eko see Senior High Asempa FM. Dr. Omanebuama, our guest in studio. We say Dr. Omanebuama cannot shed their inability to fulfill one-time NHIS premium to the single spine. Okay, cannot blame the single spine for that. What hindered them from implementing it in their second term? The NPP in same way could have also said the economy was bad, and because it's seeking a bailout from the IMF, it wasn't going to implement free senior high school, yet with prudent management, free SHS was done in the first year of the first term. Uncle Ato, it was Spentex, and on the way abraying. Dr. Omanebuama Adam Fobakopa ne Samuel Brian Boaben Samuel yeah
you say or bre you say Sami Hadwin.
I say, Obi, we cannot trust our future with Dr. Omanebuama's boss, who needs our mandate to correct his mistakes after telling us in 2016 that he has a dead goat syndrome and won't listen to anyone.
Obi now MPP for access to phone.
Oh no, maybe kind NDC for so there. Dr. Omanebuama.
Okay, this is just MPP for the bar. Now NDC for so there bar.
Baby, we have kind in now. Don't worry. Don't worry. Okay, they are coming. Don't worry. I say he froze employment in the public sector. Also told us to park our cars and use structural oil. And this from your own friend. to use trotro or a bicycle if we can't afford the volatile fuel price hikes.
We employed a lot of nurses, we employed a lot of teachers, and I will send Ghana Health Service
data
no
problem.
You
No
know
problem. This election is not about promises, but about the capacity to deliver. We know Akufo-Addo as president, and we have Mr. Mohammed's receipt as president as well. Let's protect our progress. Samuel, Brian, Boabin, and Onodiwe Abre. Ekosi says na high Asempa 94.7 FM. Yeguso FM messages. No producer say memre aso. But was a many honorable etimi wrap it up na yeshe etwaso. Enti mode ebechayen. But let me put this across now for Yenshen Twaso. A glorious happy birthday to a father and a boss, Mr. Victor Newman, Director of Research and Senior Advisor to the President at the Office of the President. I say, way free. Okay, Dakwa Newman, a parliamentary candidate for Kaikwe South, and Nana Hesi or Jerry to you. And a happy birthday to you, Mr. Victor Newman. Okay, Honorable Mepachoma, Yenshana, sorry, but way a free Sir Prince said the NDC and President Mahama is committed to their promises and they will surely deliver to tell Ghanaians. So tell Ghanaians to vote massively for John and Jane to rescue us from this bad governance. Sir Prince Owayensu, he says regards to Nana Yao Teddy, parliamentary candidate for Ayensuano constituency of the for the NDC. Obiso Mimusa say, Obi, greet Dr. Maneboama for me and ask him the state of the NDC's technical team on COVID-19.
The NDC's technical team on COVID-19 did a very good job.
Oh, okay.
They drew attention to very critical issues. Okay. And nobody should downplay it. I'm not sure anybody was expecting them to have been the people who were at the forefront providing vaccines and allowing. It was to advise. They gave documents to government. They also advocated. You understand? Things that must be done.
Yeah.
You understand? What I would rather expect, say, Yenina and Yenina Isa Obama, I ruined the MPP, everything. It doesn't show good posturing from the ruling party. It's rather to see COVID as a major national challenge.
Okay.
Now, because at this stage, Obi, sometimes the way citizens, ever COVID, people are abandoning their face mask. Okay, even hand washing, no money at their day.
Yeah.
I think that I was say a buying a sorry or so, and yes, the election process,
it take away.
It take the better side of that. Now you lose all the restrictions and now you move the inhibitions. As I say, crumple. Do baby now open cell rooms and now.
I'm for whom so we weird.
I weird. But COVID then call baby. And nothing in this manifesto. We put out clear ways that upon assuming office,
you deal with
also take to deal with it. Our intention is a number of tests now are dropping precipitously. It's not good for our country.
Number of tests,
yes, per day. The number of
you think and no accounting for the drop in new cases, Nana?
Of course, I definitely. If Obi, if you are not testing more, how do you expect to get to high numbers? It's as simple as that. Do you think that COVID has gone away? COVID has not gone away.
No, it's not.
So when you reduce the number of tests, naturally the number of new cases will go. But that's not even my major concern.
But if the test numbers not reduce it, not say if we say and no na accounting for the drop in numbers, what should happen? They say we should see our hospitals being bombarded because if you are not tested, that's who will be after 2 weeks. After 2 weeks, the symptoms will show.
You see, let me tell you, that is where lack of understanding of COVID. COVID-19 is case fatality rate for a population, for a youthful population like Ghana, is not high. So there are many who get the disease, but maybe mildly even asymptomatic, not
Yeah.
to the point
Yeah.
or they become
Yeah.
hospital.
Yeah.
So that person may not even go to the
Yeah.
hospital. That's one. Two, because of the frustrations, no money are there. Even health workers exposed when they do the test. As you have a sample now, a beko emba no money are there the crampo. Okay. A lot of unexplained deaths. Postmortem doesn't test for COVID. So when people die, okay, that's it. You are tested a nipano for a COVID and sana okay. Not just a nipano. They are not going to even the living crampo. We are struggling for the test to be done. Now we're the dead.
Look, my
yes, IBDC. So I'm saying, say, the government's approach to managing this COVID has been terrible.
Okay.
Including even kind of pneumonia they are doing in terms of logistics, pneumonia they are transparency, and until say we will increase the number of tests per day. Okay. I have also advocated strongly, say, $150 now on Mojo Airport, no, and there. That day na me new boy kan ya na me
Ekusi say on Asempa FM.
I'm adding and to Mr. You say ba speaking specifically on health about the health system of Ghana ye, because we need a health system wide approach, health system strengthening.
We have to
now,
end
at the
here.
base
Doc.
is the free primary health care, which we are going to use to ensure that we strengthen the health system. Health workers are going to have their side of it, like vehicle tax and waivers. Normally, they are setting up a Professor Jacob Planwool endowment fund for training of our physicians and surgeons. Normally, they are so all these things are installed. All we are saying is that we are asking for the mandate.
Higher Sempa FM. Dr. Edward Omanebo Amana Moten in Kano. Muntie we mame ye ba. Me panelist no aye krado. Me hu Eric J wa me hu